My name is Miss Haley, and I'm going to be demonstrating the LPN physical assessment. Supplies needed for the LPN physical assessment include a stethoscope, gloves, a working pen light, a black ink pen to take notes, and a sterile tongue depressor. You also want to have your client's record so that you can verify the physician has ordered a physical assessment. Before entering the room, you want to complete your LPN welcome steps. LPN welcome steps include L, look at the physician's order. When you're verifying orders, you're verifying that you do have the correct client that does need a physical assessment. The P stands for protocol for procedure. Know how to do a physical assessment. N stands for necessary equipment and supplies. Have your supplies on your person when you go in to do your assessment. Welcome steps include wash, sanitize, and wear gloves. Explain the procedure and the reason to the client. Locate the client's ID to assure you have the correct client. Put the client in a comfortable and efficient position for the nurse and the client. Obtain privacy. Make sure to follow the correct steps and body mechanics following good technique. Ensure safety and observe deviations from the normal. Now let's begin our assessment. Good morning, Mr. Banner. My name is Brandy. I'm going to be your nurse for the day. How are you feeling? That's good. Can you tell me your name and date of birth? I'm just going to verify here on your record. Very good. Please tell me today's date. That's correct. Today is Tuesday, May the 7th of 2012. Again, my name is Brandy. I'm going to write that here for you on the board. You'll have several people coming in throughout the day, and this way you'll remember my name. Mr. Banner, can you tell me where you are today? That's right, you're at CART Clinic. Are you in a comfortable position? I'm just going to raise the bed up so that I can reach you a little bit. Please tell me what brought you in today. You need a physical assessment. I'm going to verify the orders on your record. Dr. Williams has ordered a physical assessment for you today. What I'm going to do is a complete head-to-toe assessment. I'm going to start with your head and go all the way down to your toes. I'll be explaining every step of the procedure throughout the assessment. If you have any questions, please feel free to stop me. And I'll be asking you questions throughout the assessment as well. Some questions you can simply answer with yes, no. Other questions I may need you to give me a little bit more descriptive history. We're going to begin first by looking at your head. I'm just going to lay my equipment out here on the table. I'm going to start first with your head. Do you have any problems? Have you felt any lumps, bumps, bruises? No? Okay, first I'm going to look at your hair. When I look at your hair, I'm looking for the distribution of hair, the cleanliness, the grooming. I'm looking for any lesions, abrasions, or cuts. I'm also looking for any lice. When you're doing your physical assessment, you don't want to reach across the client. You would actually walk around on the other side for the assessment. But for time purposes, I'm only going to do one side of the body. So the distribution of the hair is equally distributed. I see no thinning, no alopecia, no dandruff, no abrasions, no lice. I'm going to then palpate the head for any lumps. And as I'm palpating, I'm assessing facial grimaces for any pain. Okay, I'm now going to move on to the face. Mr. Banner, if you would, just please look at me. I'm going to look at the eyebrows to assure that they are symmetrical. Please close your eyes for me. I'm looking for any drooping of the eyelids. Can you smile for me? When he smiles, I'm looking for symmetry of the lips and the cheeks. Okay, now I'm going to assess the pupillary response. To do this, I'm going to use my pen light. You want to turn off overhead lighting. I'm going to leave the overhead light on so that we can see on camera. But in your normal assessment environment, you would go ahead and turn your overhead light off. Okay, Mr. Banner, if you will just look forward for me. What I'm looking for is that the pupils constrict when exposed to light and that they constrict equally on both sides. Mr. Banner, if you would, please look at the pen light. I'm assessing for accommodation, that as the object is moved closer, the pupils respond as appropriate. And they do. So he does have Perla. Mr. Banner, have you noticed any changes in your vision? Any blurred vision? Any halos around lights? Or any problems with headaches? Do you wear contacts or glasses? All right, Mr. Banner, when we begin the procedure, I'm going to start with your head and go all the way down to your toes. I will be asking you several different questions. Some questions you can answer simply with yes or no. Others you may have to give me a little bit more description. I also will be asking you if you have any pain. If you do experience pain during the assessment, I need you to let me know when exactly you have the pain, if it's when I'm touching you or if it's when I'm doing movement throughout the assessment. We're going to begin with the head. Do you have any problems with your scalp? Any dandruff, dryness? Have you noticed any lumps or bumps? Going to inspect your hair. Then I'm going to palpate your scalp. I'm going to inspect the contour and the size of your head, looking for the color distribution and grooming of your hair. I'm also looking for any head lice that may exist. When you're doing your assessment, you would walk around the other side of the client to assess the opposite side, but for time purposes, I'm going to stay on this side of the assessment. After palpating and inspecting the head, I would palpate the scalp to assess for any lumps. Next, we're going to move on to the eyes. You always begin the assessment asking questions. Mr. Banner, have you noticed any problems with your vision? Any blurred vision, any double vision, or seeing lights around things that you look at? Okay, I'm now going to look at your eyes. When I look at the eyes, I'm looking at the whites of the eyes, the sclera. I'm looking at the conjunctiva. I'm looking at the symmetry of the eyebrows and the eyelids. When he closes his eyelids, do they both close together and do they stay closed? Okay, I'm going to turn the overhead light off to assess pupillary response. Mr. Banner, I need you to look straight ahead for me. I'm assessing to see that the pupils do constrict when exposed to light. Mr. Banner, if you would, please look straight ahead at the purple pen light. And I'm assessing for accommodation. Very good. We're now going to move on to the nose. Have you noticed any problems with your nose? Any problems breathing? Do you snore? Do you have chronic allergies? Do you currently have a runny nose? Do you experience frequent bleeding of the nose? Okay. I'm now going to assess that the septum is midline, and for this I'm going to again use my pen light. I'm looking for excessive mucus, and I'm looking to make sure that the mucosa is pink and moist. I'm now going to move on to the mouth. Mr. Banner, do you have dentures? Do you have any painful teeth? Are your gums painful? For this assessment, I'm going to use my pen light, continue to use my pen light, and I'm going to use a tongue blade. When I assess the mouth, I'm looking for any breaks or abnormalities in the tissue. Did you see what I did?
Go ahead.
Hi, Mr. Banner, we're going to now look in your mouth. Do you have any painful teeth or experiencing a sore throat? Do you have any dentures? To assess the mouth, I'm going to use my pen light and a sterile tongue blade. I'm going to be assessing for any breaks or abnormalities in tissue of the mouth and the lips. I'm going to look at the buccal mucosa. I'm going to look at the hard and the soft palate, assessing for any swelling, odor. I'm looking at the tongue for color, moisture. I'm looking at the teeth, the gums, the uvula, the tonsils, and to conclude it, your lips for symmetry and lip color. Can you stick out your tongue for me? Can you raise your tongue and say ah? Very good. We're now going to move on to the ears. Have you experienced any pain in your ears or change in your hearing? I'm going to use my pen light again. I'm going to pull the ear up and back since you are an adult. I'm assessing the pinna of the ear. I'm looking in the ear for any excessive drainage or foreign bodies. Hi, Mr. Banner. We're going to move on to the neck. Have you noticed any pain or swelling in your neck? Okay. I'm now going to palpate lymph nodes. We're going to begin with pre-auricular, posterior auricular, occipital, submandibular, submental, sublingual, and supraclavicular. I'm then going to assess the neck to assure that the trachea is midline.